Hello, Manchester, Hooksett, and Auburn. This is the Progress Report because it's Wednesday. When it's Wednesday, it's always the Progress Report at 7 p.m. right here in our downtown studios in Manchester.
Rain or shine or
shine.
Potential heat wave.
Heat wave, whatever. Hey, you're going to notice.
You're looking a little different today, Bob.
So are you. So's our guest. I just put this mask on, folks, because today we have one of the outstanding public servants we have in the city of Manchester with us, for Alexa Koss, who works for the Manchester Department of Public Health, which has done absolutely yeoman work to protect the citizens of this city, even before the pandemic hit, but especially since the pandemic hit. We are so fortunate that we have people like his boss, Anna Thomas, is the Citizen of the Year, Phil, equally deserving for his timeless and
the man behind the woman, right?
Either way, I mean, these two are just doing such a heroic job to protect the citizens of Manchester. And when I showed up to do this show today, I did not show up wearing this mask. Neither did my good friend Mike Farley. And Phil showed up wearing a mask, and we said, maybe we need to have a mask. And that's a perfect symbol for where we're at, or maybe not at. And we're going to get into all of that, but I want to turn over to Mike first because he has some matter he wants to lead off with.
I've started trying to get some little videos that are much more entertaining than me talking. But I read an article. It's a very short editorial, actually, that really crystallized some thoughts in my mind. And 1/3 of this article relates to what we're going to talk about on the whole show. And it's a harsh article, but sometimes the truth can be harsh. So I'm just going to go to read the article. This comes from Leonard Pitts Jr. of the Miami Herald. And he leads off with a quote from 1963 from Martin Luther King, which in itself is pretty truthful. "Nothing in all the world is more dangerous than sincere ignorance and conscientious stupidity." And he goes on, Dr. King didn't know the half of it. Those words, after all, are from 1963. Back then, the idea of U.S. citizens and lawmakers attacking their own democracy would have been unthinkable. Flouting precautions in a deadly pandemic, unimaginable. And ignoring threats to our very planet, inconceivable. Of course, back then, information came through a few reliable conduits. Walter Cronkite, Chet Huntley, David Brinkley, the local paper. There was no social media. The production and distribution of information had not yet become the province of any and everybody. Things have changed. The unthinkable, the unimaginable, and the inconceivable are hard upon us. We face not one but three simultaneous existential emergencies. And while each is distinct, it's time we understood that ultimately they are not different threats at all, but rather different manifestations of the same threat. Meaning that the insurrection crisis, the COVID-19 crisis, and the climate change crisis are really at bottom just facets of a misinformation crisis. And that's the point I want to make by reading this article. If you consider how belief in visibly false information ginned up by social media, for example, Donald Trump won, vaccines magnetize the skin, cold snaps disprove global warming, has impeded, if not paralyzed, our response to these and other issues, the truth of it becomes evident. Cronkite, Huntley, and Brinkley are long dead, the local paper just a shadow of itself. Social media purport to fill the void, and as a direct result, misinformation has reached critical levels. It's not that no one saw this coming. Warnings go back at least 2 decades, including in this very space. But the threat seemed so theoretical. Who knew that it would have such real and profound effects? Who knew it would cleave this country, this planet, like an axe, splitting the informed off so decisively from the profoundly misinformed, the adherents to crackpot theories and screwball beliefs that would have been laughed off the public stage in 1963, but that in 2021 find strength in numbers and validation online, and that now emerge as a clear and present danger. Almost done. Just this week, for instance, a United Nations panel issued a report warning that climate change has brought us to the point of catastrophe, code red for humanity. It's a truth underscored by our own eyes, by the 100-year events that now happen every year. Devastating floods, blistering heat, raging fires, rampaging storms. The damage, we are told, is irreversible. We can only mitigate it. You'd think such a dire prognosis would have us united on the need for immediate action. But Fox News saw little to worry about, bringing on climate denier Mark Morano to assure viewers that the UN just wants to take their cars. You're being conned, he said, if you're falling for this UN report. And so it goes. The need to teach our children well, media literacy and critical thinking in particular, has never felt more urgent. Indeed, it is not too much to call it a matter of survival. After all, the insurrection crisis threatens our country, the COVID crisis threatens our health, and the climate crisis threatens the only planet we've got. But the misinformation crisis either caused or exacerbated them all. So the obvious epitaph, if we do not survive these challenges, would be the ignominious but fair, too stupid to live. It's harsh. That's tough medicine to take. And
I'm not sure we just shouldn't go home and crawl into the covers.
But no, but there's hope. There's hope with information, and that's why we're here. That's why, Bob, we come here every Wednesday
okay.
to try to bring information.
There's the silver lining right there.
But this article, boy, it hammered home that feeling of nausea that I've had in my stomach, as feeling like everything is coming down. But this puts it all together. And with a little knowledge, with a little trying to find out what's right, and not believing everything you hear. Listening, for example, to the progress report and the great guests we bring on, we can solve the world's problems.
We do
so
that.
Thank you for indulging me on that. Phil, we were talking before the show. Calling people names like this may not be the most persuasive thing to do, but I think the article stands on its own, and we can now try to work around it and get the job done.
Well, I would just like to say, folks, the medium is the message, somebody once said, Marshall McLuhan, I think it was. When I arrived here tonight, Phil Alexakos, who is a guy, as I say, has done yeoman work to protect the citizens of New Hampshire, not only against the COVID, but opioids and many other public health threats. He showed up here wearing a mask, and I immediately put a mask on, and Mike ran down to his car and came back and put a mask on. Phil, why are we doing this, and do you think it's really the right thing to do?
Sure. Well, first of all, I want to thank you both for having me on your show again, and thank you for the kind words. But it really is the team that I work with on a daily basis, whether it's our local health department, our state health department. People are working around the clock to really to figure out how best to combat an evolving threat. When I was here, I think almost 18 months ago, I think it was March of 2020, one of the things that I remember writing down as an important thing to say to folks, and this kind of speaks to the article, that this is a novel virus, it's a new virus.
And move your mic a little closer, please.
And we're gonna learn as we go, but we're gonna use the best available information to guide how to mitigate and how to deal with this virus. What happens, and I think it's as much about the message changing that puts some people off, and leads to distrust or a thought that, well, you guys keep changing the message, so why should I listen to you? And I wanted to say that right out of the gate back then, because I know that this was going to happen, and I think that there have been opportunities lost with messaging, and it really breeds this distrust and this polarity that we're experiencing. And why I'm wearing the mask today is now we have different strains of this virus. The Delta variant is in the news. It is here in New Hampshire. Upwards of almost 50% of the tests that the state has done on a variety of samples are the Delta variant. It's twice as infectious as the COVID that we started with. And for those reasons, we have to think differently about our strategies. Now, if I were to be on the show back in May and into June and then early July, when our cases were down in the single digits in Manchester on a daily basis, I think we all got into the mindset that we've knocked this thing down.
We can party.
Yeah, we can party. We can start to relax some of those critical mitigation steps. Here we are, 6 weeks later, and we're seeing case rates like we had back in May when we were utilizing masks
And when
as
you
a
say we're
mitigation
seeing
step.
case rates like that, you're talking about in New Hampshire.
In New Hampshire and Manchester, one of the metrics that we use, that we've been using all along, is a three-tiered kind of community risk profile of either low, moderate, or substantial community transmission. And that's a function of how many cases you see over a 14-day period per 100,000 people. Getting into how to calculate that isn't as important as the trends. And since the beginning of July, we have seen a sharp rise in cases. I brought some data with me because
Yeah, please.
we want to talk about
Yeah, we want data.
trust. We want to talk about having the information. Over a 2-week period from late July to the 7th of August, we, as a state of New Hampshire, had about 1,600 cases, and 13 of those were due to what's called breakthrough infection, meaning people who were vaccinated.
Fully vaccinated.
Fully vaccinated. The rest of that, so 87%, are in folks that were unvaccinated. If you go back before the Delta variant became common or more common, 99% of all of our cases dating back to February, March, when the vaccines were becoming more available, were in the unvaccinated. So, we are seeing some breakthrough cases, but the good news, and this is, since we want to have some good news,
We do.
is that these vaccines are extremely effective at preventing hospitalization and death. Yes, people are still getting COVID, and we have to remember that the purpose of a vaccine.
I want to ask
Yeah.
you about that.
Yeah.
Because we hear that.
Yeah.
And we all want to believe that's true.
Mm-hmm.
And yet we hear these cases, mostly from the southern states.
Yep.
ICUs maxing out or close to maxing out in Florida, Louisiana, Texas, and on and on.
Mm-hmm.
And yet we want to believe that this vaccine that we've had, certainly we all three of us have had the
Yep.
full 2 doses, offers us protection, if not total protection against testing positive, against hospitalization, being on a ventilator, and possibly dying. So what squares that? I mean, why are these situations so dire in the South that they're maxing out their
ICUs and
their ICUs,
yeah.
their hospitalization capacity?
Yep. So it boils down, quite frankly, I'll be very candid. It's due to the low vaccination rates. Those folks who are not, they're susceptible
So
to the
it's
virus.
still true that the bottom line, with some caveats you have to put
Yep.
in, some
Yep.
asterisks, this is a pandemic for the unvaccinated, where you get the severe consequences.
And that could be unvaccinated adults for whatever reason they are choosing not to be vaccinated. Or we have to be very mindful that children under the age of 12 aren't able to be vaccinated. So we have a kind of a different kind of pathway of folks that are choosing for whatever reason not to be vaccinated. But we also have folks that don't even have that choice and aren't protected in the younger children under the age of 12.
Yeah.
And so, we're seeing a lot of things from states where vaccine rates are in the 30s and 40s of people who are eligible. And, the more folks that are vaccinated, the less likely that those who are unvaccinated, for whatever reason, are likely to get sick. And it's that density and those critical numbers that are causing these surges and a virus that's even more infectious than the previous COVID. And I will say that our hospitals, we monitored the bed counts, the ICU beds, the ventilators. We do that on a daily basis, and we've been doing that throughout the pandemic and even before that. And we're not seeing that here in New Hampshire.
So we're not stressed out on maxing out our capabilities for ICUs and
No,
ventilators,
but
at
I-
least yet.
But I will
But
say
we have
we have-
elevated
we-
transmission rates, and we could get there if we don't change the trend.
Using, I like to, I'm in the prevention business. I'll be,
Yes.
that's what I do.
Yeah.
And the more tools that we use, the better. I think people locked into the vaccine and thought the vaccine is going to protect me from getting sick. It's going to keep me from transmitting the virus. It really was not very good messaging. The messaging should have been, it's going to prevent you from going to the hospital and dying. We do know that it reduces your risk of transmitting the virus. It shortens the duration that you might shed the virus to others, even if you're vaccinated, which is all helpful.
But the
it's
amount
not
of virus
perfect.
that can be shed in this Delta variant is some exponentially larger than the original.
So you make a very good point. So people are known to shed more virus than we'll call it original COVID for purposes of simplicity. So what we don't quite know the magnitude, but if you're vaccinated and you've been exposed to the Delta variant and you test positive, you could be shedding the same amount of virus that you would have shed if you were infected with first COVID. Or
Even though your symptoms may be mild,
If at all.
you will save
Yeah.
yourself from the hospital, which is why you want to have
Right.
this vaccine.
It's-
If you
yeah.
don't mind, I
No.
don't want to derail the train of thought, but I'd like to go back to the
Yep.
kids, because there's
Yep.
one other component of COVID in children that was hammered during the beginning of the pandemic, is that kids don't get sick. To them, it's some sniffles. It's not a problem. With the Delta variant, that's not necessarily the case, and I'm not going to try to tell the story, but can you tell us a little bit about how it affects kids?
So what we're seeing, in general, it doesn't affect children as severely, but what we have to be very mindful of, again, because this is a new virus, we don't necessarily know what happens after your infection resolves. So are there going to be any long-term health consequences? So we have to be mindful of that when we try to formulate our strategies in different settings to protect folks. Maybe the rates of hospitalization are much less in children under the age of 12 than the general population, but that doesn't mean that we haven't learned something yet about what could happen after COVID resolves. So we have to think about that. It's not just, did I get sick or not? It's what else? And there are some anecdotes about, like long haul COVID and, really long recoveries and other things that we're unfortunately only going to learn. So, when you have uncertainty, it makes sense to take precautions. And, one of the precautions that we know that is effective in both protecting each other, but also preventing someone who may be infectious from spreading COVID is a face covering. Is it perfect? No. A lot of people say, well, they don't really work. They work as a tool in a layered approach. The Swiss cheese approach is a metaphor that we've used a lot to say, the first layer is a face covering. It's not hermetically sealed to your face, so there are some gaps. Then I'm going to have social distancing, so I layer on another piece. And if I'm vaccinated, I'm reducing the risk even more. And by the time you layer out protection, there are very few holes in there. And so that is closer to, zero risk. So one strategy, vaccination is excellent at preventing medical surge in the hospitals. It reduces transmission, not 100%, but it is a tool in the toolbox. Face coverings add additional protection. Screening, doing daily screenings of symptoms, that's another piece of the equation. So all of these things are useful. Unfortunately, things have been polarized. Messages haven't been clear. This vaccine doesn't cure you of ever getting sick from COVID. It keeps you out of the hospital and dying. I think if the message had been more clear about that, then we would be kind of not in this mindset now, like, I got my vaccine, now you're telling me I have to put my mask back on. I totally get it. Nobody wants to wear a mask. However, in settings in the indoor environment, we know how infectious this is. If you look at the school setting, we were out of school, no in-person learning in a lot of areas where there is substantial transmission. Well, we have adults that have been able to be vaccinated. We do know that face coverings do work when coupled with all of these tools. When you add these mitigation steps, you reduce risk. That's why the guidance from CDC is that anybody over the age of 2 should be wearing a face covering in an indoor environment like a school, like a child care, to the extent possible. the state health department today had a conference call with all the schools and child cares and local health departments, Manchester and Nashua, to talk about their guidance. And they outlined some tools to use to look at community transmission, activity in a school setting, and to help gauge the utility of wearing face coverings. If you have very low, their matrix says if you have very low to no transmission and you have no activity in the school, face coverings are optional in that setting. But when you're in substantial, like almost the entire state, you should be supporting the use of a face covering. That's what the data shows. The state's is in substantial. Manchester, Nashua, all but I think 2 counties as of 5 o'clock are at substantial, and that is very clear in their guidance. They support the use of face coverings. Ultimately, it's a local decision. There are some schools that are small towns with maybe no activity, but the county that they're in has substantial transmission. That would be weighed, but it's not a one mitigation factor is it. It's all of these layers are key.
I'm sorry to interrupt.
Oh,
and
no,
and
please.
it could change as situations change.
And that's another thing. Who really likes change? Most people don't.
Well, but you said 6 years ago that we wouldn't have to do this.
And we said 2 months ago that if you're vaccinated, you don't need to wear a face covering.
Yeah.
And then we've seen this explosion in states that had the lowest vaccination rates, and there is a correlation there. Now we have something that's more infectious, and we still don't have in New Hampshire, what is considered to be a high vaccination rate, which is 75-80% of eligible citizens.
I'd like to talk
Yeah.
a little bit about that. We're
Yep.
at a point to take a break. You want to take a quick break?
Sure.
We can regroup, and
Okay.
then I
Yeah.
would like to talk a little bit about vaccinations.
I got lots of stuff to talk about too, but you go.
Yeah.
Vaccination rates
Absolutely.
And by the way, folks, this is a call-in show. It's live.
yeah.
Please join in if you've got questions or comments for our guest or for us. 640-3091. We would welcome your participation. We'll be right back. So here we are again with the progress report for this Wednesday in August, Wednesday, August 11th. And we couldn't be more pleased to have back one of our public health officials in the city of Manchester, Phil Exakos, who along with Anna Thomas has been doing heroic work to try and protect the citizens of this city. As he said, they're into preventive medicine. The doctor you go to, he's going to try and fix you when you're ill. They're going to try and keep you from getting ill. And with the COVID, and we hope we have a little time to talk about the opioid crisis before we close this out, these are the people who are trying to get you from being ill in the first place. And it was quite a shock for me when I came in to find Phil wearing a mask, and I immediately put one on, and Mike went down in his car and got a mask. And so that's kind of the message. We
Starting
are,
to think that way again.
you know, we thought we were, you know, over the worst of this thing, and the Delta variety came along with a very high transmissibility, and all of a sudden we need to, as Phil described it, use this layered protection plan. You know, the mask, the vaccines, most important, social distancing, general hygiene, I guess, is part of it. But Phil, I wanted to ask you, you know, there was a tremendous effort to get people to get the vaccines. A lot of people were desperately anxious to get it. I don't know, you know, I went up to the lines at the SNU in the winter, and you know, couldn't wait to get in and get my vaccines. And then the president said, well, maybe by the 4th of July we'll have 70% of the U.S. population with its 2 doses of vaccine. We never made that, although we're maybe picking up again. Are we picking up again in the city and the state? As you hear these tales of people, you know, lying in their hospital bed saying, why didn't I get the vaccine? I might have avoided this.
So I'm immensely proud of the collaborative effort with the state, the National Guard. I cannot say enough wonderful things about their dedication from not only
Professionalism too. They were good.
Not only from a testing standpoint, but a vaccination standpoint. They were mission focused, and you know, just it really is a credit to everybody working together to get the people that were interested in getting the vaccine vaccinated. We were truly one of the first states to get, you know, people move through in our most at-risk populations, but we have seen a real plateau in the last few months with, you know, looking at the latest report, about 54% of New Hampshire residents that are eligible for the vaccine, of total citizens are vaccinated, and it's another tricky thing about looking at data. When you have to be very careful, it's 53% of the population is vaccinated. That includes everybody, including
even the kids.
The kids that can't get the vaccine.
So we kind of look at it two ways. You know, we want the level of immunity to be 70, 80%. That's sort of why that goal was
of total population.
Right?
So we're 20% down. We're 50% down or so. From where we should be.
So over the last few weeks, there has been an uptick in interest in the vaccine. We host standing office hours at our health department, 1528 Elm Street, for anybody, not just Manchester residents. And folks can come. We have either staffed, supported, or run over 220 clinics over the period from February through June. And we gave, I think, about 17,000 doses, which I'm super proud of all of the work that my colleagues put in to make that happen. Our friends at Manchester Fire, et cetera.
Anybody can show up at your public health
They can come
office and they can get it. They can get the vaccine.
We have all 3 vaccines in stock, so that people have that option. There are some contraindications, fancy word for reasons why somebody can't get a vaccine, whether it's an allergy or there may be a cultural or religious belief that may preclude somebody from getting a vaccine. Each one of them is made slightly differently, so that there are options for anybody to hopefully make those barriers go away. On Monday mornings from 9 to 11, we have walk-in clinic, and on Wednesdays from 2 to 4, we have walk-in clinic.
Anybody can
free
show
of charge. Anybody, bring your friends. And
please bring your friends.
Please bring your friends. And we, you know, it's over the last week or so, we've definitely seen an increase. I say increase. You know, we've seen maybe today we had, I think, 14 people, which is pretty good.
Yeah.
You know, we try to get out in the community when we're not busy dealing with the increase in cases. And so, you know, we're definitely going out to community events.
Well, we've got the community coming in on the phone here, Phil. So,
good.
Caller, you are live on the progress report. Go right ahead.
Great. I got a quick question for the guest.
Excellent.
All right. Should there be more emphasis on treatment? Okay. In other words, let's say you get COVID, right?
Mm-hmm.
What should you be telling your doctor? Should you be telling your doctor you want hydroxychloroquine, you want telemedicine, so on and so forth. Should there be less emphasis on prevention? Should we maybe take the attitude that it's here, it's not going away, it's going to be with us for years, and if you get it, there's a 99 point something survival rate, and it's very important that you get these treatments that are available. I'll hang up and listen for your answer. Thank you.
Yep. Thank you very much for your question. There is research and there are trials being done with different treatments. I know that if you go onto social media and other places, there are lots of ideas about lots of things, and we have to be very mindful that anything treatment-wise has gone through a rigorous process to, one, obviously make sure it's safe, two, make sure that it's actually effective and that there's not another reason why somebody may be improving, but there definitely is better treatment. In the clinical environment, they have better methods of providing supportive therapy that they didn't have before. They understand how the disease presents itself. I'm in the prevention business. I don't want people to get sick. Because if you get sick and you're treated, it doesn't necessarily mean that you might not suffer from some of those
Or spread it to somebody
unknown
else.
consequences. But they're definitely having a discussion with your healthcare provider is always the best thing to do. You have that trusted relationship with your provider, and they would have the best information knowing your medical history. There may be some remedies or treatments that are either talked about that maybe there's a reason that if you were to have that treatment, it could have dire consequences. So we just have to be mindful. It doesn't mean that some things, naturopathic, treatments, there's a lot of talk about things like zinc and more vitamin D, which are probably good anyway, and can be helpful. There are other things that are pharmaceuticals that, not knowing your medical history, we'd have to be mindful of. Definitely treatment is something that is being looked at. There are monoclonal antibody treatments available now that actually can be used in the intensive care environment that can help people that are most affected. But just remember, this is something very new, and we just have to treat it a little bit differently than we do the common cold and influenza, that we have more experience knowing that there aren't necessarily long-term consequences, but because this is new, we tend to take a more conservative approach to prevention.
Phil, you were very accommodating in that answer, but wasn't the question sort of like, well, we've got the iron lung, who cares about a polio vaccine?
Well, if you talk,
if you're talking about treatment, yeah, we had treatments for polio. We had treatments for a lot of these diseases that now we don't need to have treatments for because we've got vaccines. And by effectively applying the vaccine over time, they've been either eradicated or close to.
Yeah.
So to just wave the white flag and say, we're always going to have it, let people get sick, we'll just take care of them. It sounds very defeatist to me, Phil.
Well, I'm not. Treatment is we call it tertiary prevention. It's the last step in the equation of health. Prevention, obviously, is something that I'm looking at. For good reason. And if you think about costs associated with healthcare, long stays, long-term disability, or other things that could be impactful, there's a cost benefit to everything.
Which puts a little bit of irony into these arguments that we're having, doesn't it?
I have my laser focus is on before you get sick, and hopefully you don't end up, or a loved one or someone who's immune compromised, ends up. But certainly appreciate the call, and just do your due diligence in the treatment realm, because this is evolving, and make sure you have a discussion, because everybody's health is unique to them.
So another thing I wanted to bring up with you, Phil, we're not too far away from the reopening of schools.
Mm-hmm.
Here we are, almost in the middle of August, amazingly enough, and school opening is not that far off. And so we have another call.
Well, I think
Sure.
we're in a debate
good.
now.
Hi, Eddie.
I think I caused the
I'm
debate.
going to desist and let you go ahead. Eddie, welcome.
No, not Eddie, Phil.
Oh, hey,
Phil. Okay.
Good to hear from you. We were just turning to school, so an excellent caller to have.
Something on the legend made me make that mistake. Sorry. Go ahead.
That's all right. That's all right. I just, the city has many assets, and I just want to say, Phil from the health department is one of them.
Oh,
To
thank
hear
you.
him speak and to listen to his professionalism and his advice, and I just wanted to thank you guys for doing your show. Thank you for having him on, and it makes complete sense to me. And a lot of times on shows like yours or other shows, it gets a little negative or it gets a little controversial. I just wanted to say, what a refreshing show tonight to hear somebody that's an expert in his field, and it's a tough situation, obviously, but to have the Manchester Health Department and his team working on it, God bless you guys, and thank you for your efforts.
Yeah, that's very
Thank
nice,
you.
Phil. Thanks a lot.
We
Much
all agree with
appreciated.
those nice sentiments, and thank you for that expression.
That reinforces the message a little bit.
It does. But I was going back to the reopening of schools. And, we still don't have approval to vaccinate people, young people under the age of 12. Is that right?
Correct.
And that's a big chunk of our school population.
Mhm.
You told me before we went on that you have a very good working relationship with the school district. Glad to hear that. What is the basic theme what are you telling them needs to be done to reopen our schools and keep these kids safe from this now much more highly transmissible Delta variant?
So, thank you for that question. We've had an amazing relationship with the school district. It really is a team effort. I wouldn't say that we tell any of our partners what to do. It's a collaborative discussion about what is the best available information and how do we translate that into a child care setting, a school, a health facility. Each setting is unique, a business. We've worked extensively with Dr. Gillis, who's been in charge of, everything from facilities to, ventilation, and also we also house the school nurses, they're health department employees. So Jen Wyman and Jamie Hobecky from our office have been working with the school nurses who have taken on amazing roles and responsibilities around contact tracing, which was a new skill set. So we've been able to partner with each building, having a point of contact, meeting weekly to talk about needs and issues in the buildings. From a facilities, a disinfection standpoint, we upgraded ventilation in the schools,
Talk a
which
little
is
bit about
really
that. Are
important.
all the schools got updated ventilation so that that provides a certain additional layer of protection?
Exactly. So in that layered approach, there are, I think, 9 different categories of mitigation steps. Increasing the amount of fresh air that comes into a space, otherwise known as turnover, is something that all of the schools had adjusted at the beginning of last year. Additionally, all of the filtration was upgraded to what's called MERV 13, which is filtering out not only like large particles like dust and pollen and things of that nature, but getting down to close to HEPA level filtration. There are some schools that, they're actually, there was a meeting, the school board authorized a substantial amount of infrastructure improvements to further increase airflow and really make some huge investments in upgrades that will only help over time as well. In places where the MERV wasn't available, that higher filtration, portable HEPA units were placed in spaces. There's a designated room in each school that is we call it the waiting room, that if somebody is exhibiting symptoms, they will go to that room. It's under negative air, so the air is pulled out of the space, vented outside, so that none of that air is seeping into other surrounding rooms. And those also have HEPA as well as the nurses' offices. So, we've made substantial improvements in cleaning and disinfection, working with Aramark, who's been an amazing partner. They have made sure that we've had the best available disinfectants that are effective against COVID, but they're also the least toxic chemicals available to say
You're
that.
dealing with kids.
Yeah, it's basically a hydrogen peroxide based disinfectant that breaks down into oxygen and water, so there's no, residual, so to speak. So we were very fortunate to have that partnership. So we're really layering all of these things. And so last year we worked before there was any state, matrix or color coding system to really think about how do we measure activity and risk, and what are the steps that we're going to take when we get to a certain level. Things have changed a little bit because all of the staff have been eligible to be vaccinated. Some of the students have been eligible to be vaccinated. We have all of these other layers in place. And because we're seeing substantial transmission and we have something that's more infectious and not everybody is vaccinated yet, it kicks us back into wearing face coverings, where at the end of last school year, we were in the moderate category, and we had a decrease in cases. The guidance was at the time that face coverings could come off when you were at your desk. And if you were moving about and you weren't able to socially distance, then you would have to put your face coverings on. So this matrix approach is, looking at layers of protection, looking at transmission, looking at vaccination, and it's slightly different than last year, where we didn't have vaccine in the community. Our healthcare system was surging to the point where we had set up an alternate care site, or a surge facility at Southern New Hampshire University's gym, field house.
I remember
that was about as dire. You see on the news tents outside of hospitals. There were tents outside of our hospitals to do like screening and triage and testing, but we were definitely at a pretty critical point. We're not there. I want to be clear, we're not even close to there now, but why not double down on things that we know are useful? And that's why we're unfortunately saying, if you're in the indoor environment, you should wear a face covering. And quite frankly, the way I look at it is, it's not somebody telling me what to do. It's just being a good person and caring about others. I don't know how to frame it any other way. It's not, I don't feel like I'm being oppressed. I feel like I'm doing my fellow person, man, woman, and child, a service by just, appreciating them and caring about them.
I think that's an outstanding report you've just given us on all the changes in our school district to be ready to be at the maximum achievable level of safety for our
they can be
not only students, but
in-person and
staff
safe.
and teachers.
Yeah.
I had no idea that much extensive work had been done. It's really impressive. And I think the public should know about that this school district, and working with people like you and the Manchester Health Department, I'm sure others involved too.
Team effort for sure.
It has really achieved an outstanding level of protection to the best technology and knowledge we have. It just
Kind of strikes me as like an escalation of force in the face of a threat. A high threat, you have the higher precautions. If the threat goes down, and which is incentive, is it not,
Right.
for everybody to do these things,
Yeah.
so that
And
we
if you-
don't have to do them that long.
And you can look at diagrams of where we were and where other places in the country, and it's fairly simple, because these things follow patterns typically, and we've seen surges and ebbs and flows. So why wouldn't we, as we're starting to see this uptick, kind of tighten the reins a little bit and see if we can mitigate that? Who wants to wait till we get to a point where I have to go to the hospital and there's not enough staff? It's not only about beds. We also know that in the healthcare environment and any businesses right now, that staffing is an issue.
For sure.
Just getting staff, whether it's COVID related or not, is a challenge. So I could have 250 beds, but I may not be able to staff them all. So anything that we can do to remove those issues ahead of time, that are reasonable. We're going to have in-person learning. As a parent, couldn't be happier about that. My wife is an educator. She's really happy about it because
The kids are happy about it too.
and the kids are happy about it. We are, going to be, dealing with at all levels, whether it's, adults, children. This has been a really difficult time. And, we're being mindful as a health department of, working on using some of the American Recovery Act funding, to.
For the purposes it was intended, huh?
Yeah, to recover.
Phil, we have another caller.
Sure.
You're generating some interest in the community. Hello, caller. Thanks for calling the progress report. Go right ahead.
Hey, Mike, it's the same caller, so I don't know how much interest. It's
No,
We've got one very interested guy.
No, happy to hear from you. Thank you.
Go ahead.
Mike, your polio analogy, I don't think is accurate because it's apples and oranges, but let's go beyond
Okay,
that.
fair enough.
I thought it was very telling when Phil said, when I talked about treatment, okay, as contrasted to prevention, and Phil said, well, look, I'm in the prevention business. That's what he does. So he's focused on prevention, right?
Yep.
Well, as far as prevention goes, by all means, wash your hands, don't abuse drugs and alcohol, maintain a healthy lifestyle, but go ahead and live your life. And you don't necessarily, my point is, you don't necessarily need to wear the face diaper. There are treatments for this if you happen to get it. And that's all. I thought it was very telling when Phil said, he basically said that he's focused on prevention.
Well, I
That's
guess,
what he does.
shame on him. Shame on him focusing on prevention, doing his job.
Get this, get that, change this, you can't do this anymore. My point is, there's treatment available for this. As far as the risks involved, hydroxychloroquine has been used for 60, 70 years in parts of the globe where people suffer from malaria. It's like taking salt tablets or
Okay,
drinking
I think you've
water.
made your point.
Okay, all right, I just wanted to clarify that.
Well, I just wonder, are you saying that you're going to maybe not get the vaccine and not wearing a mask because you're not so worried about getting the illness because I don't think it'll be that bad?
Oh, well, we lost him.
Well,
I mean,
that's what you seem to be saying.
it's important. I mean,
I just can't get over it. Hey, look, this guy's, he's all about prevention. We can't listen to what he's got to say. I just, that attitude baffles me.
well,
Isn't that the idea?
I mean, I like to think that
I mean, it costs
Yeah.
money to treat these illnesses, and
the cost of healthcare alone, is a very significant driver of our economy. So,
sure.
I mean, you can do cost benefit. Things are evolving. I don't see why certain mitigation strategies have been polarizing. It's not what I want to stress is I think we can all look at some of these mitigation strategies as an effort to prevent what we had to do in last March, this March before, to shut everything down. Nobody wants to go there. There's a lot of lessons to be learned, a lot of things to be sorted out about what happened, and we call that an after action report. So we're going to take a really hard look at all of what happened so we can do it better and more efficiently the next time. But I think it's important. Nobody wants to shut anything down. Schools are going to be in person unless there's so much activity that staff and kids are out on quarantine. So we're not going to go back in that direction unless something like our healthcare delivery system is completely overwhelmed. And the way that we prevent that is by doing the simple mitigation steps, which, face coverings help. Vaccination is a key to reducing risk and transmission. Just.
but what about
focus-
my life? I'm here and I'm just not living. I'm being sarcastic,
I know,
Phil, and I shouldn't with you because you take it so seriously.
I try my best.
But I'm trying to be that,
listen.
I'm trying to understand that. Look,
Yeah.
it's not so bad. That's what I don't understand. You'd think that people were getting stuck up in their wallet taken from them or something. It's a little thing that you do. You don't do it all the time. When you're in your house, you don't have to do it.
I like to think of it as trying to do right by others, and that's how I frame it. But it's important to hear different perspectives, and there's an opportunity to discuss, and
We certainly get them.
maybe there's some common ground, or people might be willing to do things. We all did a lot of things that I didn't think we would ever see in terms of closing stuff down and very
Yeah.
draconian things.
To think
because
where we were last winter,
surging. I know.
This operation here was shut down entirely.
Yep.
We were doing things by Skype. Nobody was in here. I mean, we have made some progress.
Yeah.
And
This is
compared to that.
this is the progress report after all.
This
We
is
have
the
to,
progress
we have to
report.
talk
wanna-
about some positive
we like
things.
We like to report on progress.
Right.
And the fact that we have to choose to do as we did tonight, this show wearing masks, that's nothing like not being able to do the show here at all.
Yep.
So, one other thing, and I know this is probably, should go to the CDC people more than you. The issue of booster shots. What do you got on that? I mean, there's beginning to be a lot of concern that maybe this vaccine its efficacy will be diminishing after 6 months or so.
Yeah, and-
What's your thought on that? I mean, will you be
So-
offering booster shots to people, do you think, at the Manchester Health Department?
So my focus is as soon as we get the emergency use authorization, say that 5 times fast, or a entire approval. So there are some people that we've heard this isn't approved yet, it's only for emergencies. I think there may be some people that is what they're basing their
reluctance on.
informed decision on.
Yeah, yeah.
And that may come at the same time that they have enough data from pediatric population to authorize that. We will be in a position to work with our partners, and I want to say a really special thank you to our not only Manchester Fire, but also our surrounding communities. I know you get out into the burbs, so to speak, and the towns of Bedford and Goffstown and New Boston and Hooksett in particular really stepped up. Their fire departments, their school departments, SAUs, their school nurses all worked with us, trained, and were running their own clinics for their own faculty and students is something that I'm immensely proud of. And I feel like, should we have to do boosters or when we're ready to do, 5 to 11 and make that opportunity available for folks, we can do that very quickly now and with,
You have
real
the trained people
competency.
in place.
So, before we get to boosters, I think we're going to see getting the vaccine to the next cohort of people that are eligible. I know.
Including young people. Really,
Young
under
people.
12.
Yep. And I think the other, to answer your question about boosters, it's really challenging. I mean, it's bad enough when messages are changing, but when other countries are doing things differently for whatever reason, there are a couple of countries that are talking about boosters in people over a certain age. I'm not sure where the cutoff would be, or people that have certain immune compromised conditions or compromising conditions. That's also a function of what does their entire population look like in terms of their vaccines. But you also, looking globally, there are countries that are barely vaccinated. So, there are a lot of ethical discussions about this, and
Yeah, why aren't we helping
Yeah.
the rest of the world? Because it's an interconnected world. That's something that bugs me. Apparently, have way more vaccines than we're able to administer to the people in this country who are willing to be vaccinated. So,
Yeah.
why are we?
There's a lot to do with that. I mean, the handling of the vaccine, the low temperatures that it requires.
Well,
I know
that's
they're
only for the
improving.
Pfizer one,
I
right?
understand, they're improving on that.
slightly above my pay grade, to be honest. You can't
Yeah.
tell.
You can't
solve the world's problem?
You can't tell the sarcasm
Yeah.
with the face covering, which is sometimes a benefit when you are working remotely or on a meeting. That's my
Yeah.
attempt at a joke, but in all
This is
re-
above your pay grade too, but we're getting close to the end. And
Oh boy!
I guess we're not going to get to.
Does that mean
opioids.
Does that mean
We
I
got-
have to come back?
You got to come back. You got to come back.
Okay.
But
should
we've
book a
heard
date.
we've heard this thing that one way or another we hope to get to herd immunity, where the vaccine's losing because so many people have either been vaccinated or they've had the illness and have some immunity as a result. Is that still something that you think we can expect, or are we going to have to live with this in some form with some mitigation measures indefinitely? Do you have any idea?
So
I mean, that's above your pay grade for sure. It's certainly way above mine, but go ahead.
So the concept of herd immunity is obviously thrown around a lot. There are some viruses that we've eradicated, like smallpox,
Right?
because enough people were vaccinated. We were able to, I think in 1981-ish, plus or minus a year, it's no longer found in the wild, so to speak.
Right.
There are other things like polio that are vaccine preventable that in the developed world we don't see. If there's civil unrest when people aren't vaccinated, these things can pop up and outbreaks can happen. We see that with measles, mumps, where there are pockets of unvaccinated folks, and it's still present, although it's very much reduced. Where this lands, it's not like influenza, but it's not like, to the caller, it's not polio. It's it's a different virus. Herd immunity for this virus, what we're hearing is 75, 80% would be a really good number, but that also comes along with doing things to protect the people who are unvaccinated and then able to transmit the virus.
Yeah.
So it's going to take a combination of things. If there are other treatments, to the caller's point, if there are treatments that are effective and safe for all ages, then that may be a factor in how we manage it. I don't want the caller to think that we were dismissing his ideas, because they are part of the equation. There's nothing. I think we all like things to be clear cut, black and white, but there's pieces. There are some people who can't be vaccinated for a medical reason or for some other reason, and for any virus or infection, and you want to have treatments for those too.
Yeah.
But preventing someone from getting sick when you can have the tools to do so, I think that there's an ethical component there. But we don't know what the future will hold, other than we have the tools at our disposal, if everybody is on board with implementing them.
Yeah. This whole anti-vax thing just befuddles me. We all, as kids, get our smallpox, not smallpox,
Well, there are kids
chicken
that
pox
aren't,
and
parents that are refusing
mumps
those
and
these days.
rubella and all that. I don't remember anything like the pushback against those vaccines. Maybe there is a little bit, nothing like we've seen on this. I just don't understand it. When, as far as I could tell, this vaccine is proved to, these vaccines have been, a miracle. I mean, think where we'd be if we didn't have these vaccines. And so, anyway, Phil, it's wonderful to have you come on. We really
Thank you.
appreciate it. I know you have long days every day, and to take an extra hour in the evening to be here is just terrific. You have so much to offer.
Much obliged.
You're
Communications as well as the job you do every day.
Well, thank you for
So
that.
that's really good, and we will have you back for sure.
I
And, we will look forward
am
to having
happy
you.
to do so.
Okay. I guess that's it, Mike. Oh, I just wanted to make one more thing, Coming up on September 12th is the Manchester Bike Tour, one of the best events in the city, sponsored by the Manchester Conservation Commission. It's a modest fee. You go into the Manchester Conservation, look at their site. You get a Puritan and a catered lunch. You get a T-shirt, and it's good. Take care.
See you next week, folks.
See you next week,
Thanks for
folks.
watching.